Welcome to Adolescent Births.
I'm Fallon Chang, a biochemistry major.
I am Isabel Reyes, a biology/private major.
Evelyn Driga, environmental science major.
Evelyn Casillas, biology major.
And I'm Belcha, and I'm a chemistry major.
Okay, so the rationale, our broad topic and the problem is how does ethnicity affect the causes of adolescent births? And this topic is important because around a total of 194,377 babies were born to women aged 15 to 19 years old for a birth rate of 18.8 per 1,000 women in the age group. Young girls from different ethnicities and ages around the United States are getting pregnant for various reasons. And this is a significant factor in society because girls are becoming mothers at a young age and aren't able to experience their adolescent life. For my first source is the pregnancy in adolescents. So the key findings in this one is that the United States continue to have one of the highest adolescent birth rates out of all the other countries. There are different negative consequences of the adolescent childbearing that includes the lower education attainment, poverty, limited career opportunities, lack of access to prenatal care, low birth weight or preterm delivery, and family conflict and depression. And my second source was teen births, and the key finding for this one was that all teens who gave birth were unmarried. 89% of teens that were aged 15 to 19 that gave birth were unmarried in the year of 2017. And that the birth rates among teens reflects a number of factors, including cultural background, opportunities for employment or higher education, and the collective experience of racism or other discrimination. And the sexually experienced Hispanic teens are less likely than other teens to talk about partners, about contraception before their sex. And then for my first article, this graph shows that an average of 20% of young teens from the grades 9 to 12 use condoms more than birth control. Some of these causes teen pregnancies are due to no use in condom or birth control pills due to no education. And then for my second article of teen births, this one has a graph that states that the birth rate decreased in race, but the Hispanics are still fully higher than the rest of the ethnicities.
So, my first source was a population based study on 37 million births of pregnancies and young adolescent mothers. And the main takeaway from this article was that mothers younger than 15 were more likely to be Black and Hispanic. And as a result of these mothers being young, they were less likely to have access to good prenatal care and a higher probability of not having any prenatal care at all, which would lead to high risk pregnancies. My second source was state disparities in teen birth rates in the United States, which also confirmed that Hispanics and Blacks have a higher percentage of adolescent births per 1,000, and that teen birth rates are consistently higher in southern and southern western states and lower in northeast and midwestern states.
Okay, so for my first article, association between adolescent pregnancy and family of teenage births. Teenagers are more likely to have an adolescent pregnancy if their family has a history of teen births. This information is based on a survey taken of adolescents, Latinas, and Blacks, and there is more likely for an adolescent to have a baby if their siblings as well as their mother have a baby at a similar age before before them, rather than it just being either their mother having a teen pregnancy. For my second article, sexual abuse is a factor of adolescent pregnancy and child maltreatment. Whites, Black, American Indian, Hispanic, Asian, multiracial adolescents within the ages of 14 to 20 were studied. 55% of the adolescents were tested became pregnant due to they have been molested. The main reason based on the clinical studies for adolescent pregnancy is sexual abuse along with other mistreatments, mainly sexual abuse. On the graphs, 4.8% pregnancies happen when they have a mother and sibling pregnant in their teen years. 4.5% of pregnancies occur when siblings have a teen pregnancy, and 3.4 pregnancies happen if only their mother has a teen pregnancy. In the second graph, whites are 66.8% maltreated, 61.3 molested, and 47.5% attempted rape, along with 47.7 raped. Blacks are 69.6% maltreated, 41% molested, 29.9 attempted rape, and 34.6% raped. Hispanics are 60.6 maltreated, 34.3 molested, 21.2 attempted rape, and 32.4 raped. American Indians are 63.5 maltreated, 52.6 molested, 25.5 attempted rape, and 42.3 raped.
My first article was the facts and challenges that complicate teen pregnancy. The teen birth rate in the US remains the highest rate among industrialized countries due to unplanned pregnancies. The birth rate for women aged 15 to 19 years were was about 18.8 per 1,000 women living in fear, having no family support, and other teens began to consume drugs and alcohol, increasing the risk of premature babies and other complications during their pregnancy. My second article was adolescent pregnancy is a serious social problem. 21 million girls ages 15 to 19 years and 2 million aged under 15 years became pregnant in developing regions. An increased estimate of 115 births in West Africa, 64 births in Latin America, and 45 births in Southern East Asia. Adolescent pregnancies occur most in marginalized communities which have more poverty, lack of education, and unemployment. About 15 million girls at the age of 18 are forced pressure to marry, and 90% of these births occur in marriage at the age of 15 to 19 years. And this is my chart of high percentages of birth rates in different regions.
My first article that I found my key findings was called Teen Pregnancy by the CDC. From this article, it states that Hispanic teens had the highest birth rates. Factors such as low education and income may influence adolescent births, and teen mothers are more likely to drop out of school and face unemployment. My second article, Racial and Ethnic Disparities Persist in Teen Pregnancy Rates by Teresa Wiltz, showed that lack of opportunity is a big factor in teen pregnancy. American Indians/Alaska Natives had the highest birth rates, and birth rates decreased over time due to better education and more resources. The second graph, I got it from my second source, and this was a graph to show how in 2016 and 2017 there's a bit of decrease in the birth rates, but American Indians and Alaska Natives still had the highest birth rates.
For methods, We have our ethnicities and relations of cause of adolescent pregnancies. Uh, Based off the information summed up, Hispanics have a high percent of adolescent births due to history on no sexual, due to family history and no sexual education. Blacks have a high percent of adolescent births, even though it's less common for the causes listed on the graph. And we see that the whites as well as the Asians also have a low percent of adolescent pregnancies based on the causes listed down below.
Our synthesis. How does ethnicity affect the causes of adolescent birth? Our hypothesis was adolescents from different ethnicities throughout the United States at the ages of 15 to 19 years became pregnant for various reasons, creating hardships throughout their adolescence, resulting in health issues for their unborn child and themselves. Adolescents in the Latino and Black communities seem to have one of the most cases of adolescent births, with the ages of 15 to 19 due to their family history. Adolescent mothers often lack good parental care and many times don't receive any parental care. Adolescents from different ethnicities are victims of sexual abuse that at a young age they become pregnant and have health issues.
The impact on science that this could have, it could prevent upcoming future scientists from becoming one. Many women have dreams about what they want to be in the future, but having a child will greatly hinder that.
The impact on society. Adolescent birth has an impact on society because due to their pregnancy, some adolescents stop going to school, which means that they don't graduate. Many times they won't go back, and there's less professionals in different fields due to the adolescents being scared or embarrassed to go back.
The impacts on the economy adolescent births will have is that teen births will have an impact due to the fact that these young adults do not have any money for the pregnancy and to support the baby or even themselves. It impacts the issues of money and eventually can lead to teens to be in debt. This slide is used for our references and sources that we use to create this presentation.